Treating bruises with a BBL device. So this was a patient of mine that I did under eye filler on. She bruised, as you can see, under just her right eye was a little bit more bruised than her left. The left wasn't as bad. And this was 2 days post filler on that top picture there. So that was before I touched her with the BBL. And that second picture is 12 hours post BBL. So my settings were 15 joules, 15 milliseconds. I used a 7mm adapter. I used 20 degrees Celsius cooling. And the trick here is to not completely eliminate this bruise. We're just helping the process of that bruise getting eliminated. We're just helping with circulation. We're helping to break up those the deoxygenated blood to help expedite the healing of this bruise. So you can see in the third picture down, the untreated area there. So that was her second BBL about 5 days post. So what I did here was use that 7mm lens. We have to be very careful to not overlap your pulses, so you don't want to cause a blister, and I'll show you what that looks like in a second. So too much heat, because this is very pigmented, too much heat could actually cause a blister, and you can over-treat the area and you're just defeating the purpose. So you can see where it was untreated. When you're using a circle lens, it's going to be hard to get complete coverage of that bruise, but you have to try your best. And I do like that 7mm because I can get a little bit closer together versus the 7mm attachment and adapter. So for her, I did end up doing 2 BBL sessions. Now this is important to do only when the bruise is purple or blue. It will not work on yellow or green. It needs to have that deoxygenated blood present. And she came day 3 and then day 5. And then you can see on that bottom picture, that was 2 days after her second BBL, and that was 7 days after her filler injection. So she was very happy. You also would notice too that the pigmented lesion underneath her eye got a little bit lighter too. So she was happy about that. So the trick here is to cool the skin, and I learned this from Loretta Zanotti. She's a laser trainer with C.A.N.S, but pre-cooling the skin is everything with using the BBL on a bruise. So pre-cooling the skin, and by the way, these settings is what I got from Loretta as well. So pre-cooling, so you let the lens hit the skin for a few seconds prior to triggering your laser or your BBL, and then you pre-cool and then cool afterwards as well. So you hold it there for a few seconds, pulse, then hold it there for a few seconds. So I'm going to show you next a picture this is actually from a colleague of mine, and she did get a BBL done, and let me show you what this looks like. So she had a significant bruise underneath her eye. She also had some swelling, and this was immediately after the BBL treatment. So she said here that it hurt. She said that it was pulsed multiple times. She doesn't know what the settings were. She just knows that it was a BBL device. So first things first, when she says that it was hurting, that's a warning sign that it was probably too much heat. So then 3 days later, one of the spots did turn into a blister. Then 1 week after, it turned into a scab. So definitely over treatment here. We should not be blistering our patients. And then 1 month later, it was still not fully healed. She still had a little bit of PIE or post-inflammatory erythema, and I don't believe it was atrophy or an atrophic scar, but this is what can happen if you overtreat a bruise with BBL. So just make sure that you are just pulsing it 1 time. I forgot to mention that, so only 1 pulse. Don't go over and over it. Another case that I saw was a BBL being used on also an under eye bruise. The practitioner went over it 3 or 4 times, and what ended up happening was the patient messaged us the next day saying that the bruise got worse. So what was happening there was we were creating more circulation with the heat. We were causing vasodilation, and we caused basically a delayed bruise. So only 1 time, it only needs 1 pulse. We're not trying to, completely eliminate all the pigment in 1 shot. So let me know if you guys have any more questions in the comments. And this, by the way, this was with the BBL Hero, not the Heroic. Okay? Thank you.